Kia ora, and welcome to the Ministry of Justice COVID-19 Rapid Antigen Test Guidance video. In this video, we will take you through when, where, and how to take a rapid antigen test when attending court. To start, if you have symptoms, please do not come to court. Instead, contact us on 0800 Courts to discuss next steps. As a reminder, symptoms can include one or more of the following: a new or worsening cough, sneezing and a runny nose, fever, sore throat, and shortness of breath. Please see the Unite Against COVID-19 website for the most up-to-date advice. Attending court. A case participant may be asked to take part in regular COVID-19 rapid antigen testing for the duration of the hearing. The frequency of testing will be confirmed by the presiding judge. Testing is voluntary. If you do not wish to be tested, please talk to court staff and they will arrange for you to speak to the presiding judge. When and where to take your test. On day one of the hearing, your test will be supervised by a healthcare provider on site. Court staff will instruct you on when and where to take your test. If you have any questions, ask a member of the court staff. On subsequent testing days, you will self-administer the test at home before you come to court. You will be provided with a test kit with sufficient rapid antigen tests to last the duration of the hearing. These tests are provided for you to use for the purpose of this hearing and should not be shared with anyone else. We will now take you through how to take a test. Before taking the test, wash or sanitize your hands. Use a sanitized flat surface. Place the test materials out in front of you. Read through the instructions carefully, as some tests might have slightly different steps than demonstrated in this video, and have a timer ready. The testing kit normally contains a nasal swab, a tube with liquid inside, a nozzle cap for the tube, a test device to place the sample, and a set of instructions. Please note there are different brands of testing kits in use. Many tests will follow similar steps, however please read the instructions provided for your specific test and check you have all the items listed. Preparations. Ensure you have enough time to complete the test in full and everything you need is on hand. It might be a good idea to have some tissues ready. Some tests may call for you to blow your nose before taking the sample. Now that you are ready to begin, open the test pouch along the tear line. Take out the test device and ensure it's intact, then place it on your sanitized surface. Remove the seal from the test tube and place the tube on your flat surface or in the tube holder if provided. Be careful not to spill any of the liquid inside. Taking the sample. Remove the swab from the packaging. Ensure you only touch the handle of the swab and not the soft pad at the tip. Slightly tilt your head backwards and insert the soft end of the swab into your right nostril. Slowly slide the swab about 2 centimeters into your nose until you encounter resistance. Do not apply any further pressure. Make sure to insert the swab parallel to the roof of your mouth, not upwards as seen in the image below. Rotate the swab 4 to 6 times against the lining of your nose for a total of approximately 15 seconds. Remove the swab from the right nostril and repeat with the other side using the same swab. The sample must be collected from both nostrils using the same swab. Diluting the sample. Insert the swab into the tube until the soft pad is submerged in the liquid. Squeeze and hold the tube just above the tip of the swab. Rotate the swab at least 10 times to transfer the sample into the liquid. Keep squeezing the sides of the tube lightly while removing the swab to properly extract the liquid from the soft pad. Place the used swab in its original packaging for now and seal the tube securely by adding the nozzle cap. Hold the top of the tube and shake or flick it to ensure the sample is fully mixed. Be careful not to spill any of the liquid. Performing the test. Place the test device on your sanitized flat surface. Hold the tube upside down directly above the circular well of the test device. This is where you drop the required amount of liquid as directed in your test instructions. Gently squeeze the sides of the tube if necessary. Set a timer and read the results after the time indicated in the instructions. Most tests require 50 minutes and are no longer valid after 20 to 30 minutes. Wash your hands with soap and water or use the hand sanitizer again after performing the test. Interpreting the results. There are 2 letters next to the result window of the test device. C stands for control line. This shows the test worked properly. T is the test line. This shows the infection status. If there is no visible control line next to C, the test is invalid and you need to perform a new test. Positive test result. If both C control line and T test line are visible, this indicates the test worked correctly and the result is positive. Please look carefully. The test should be considered positive if 2 lines are visible, even if one or both are faint. A positive test means it's likely you have COVID-19. Negative test result. If the C control line is visible, regardless of how faint it is, and the T test line is not visible, this indicates a negative result. Again, look carefully to make sure there is no faint T test line visible. If you test negative, inform the court staff of your result and deposit your used test in the dedicated bin provided. Wash and/or sanitize your hands after depositing the test. You may now make your way to the courtroom. If you are a member of the jury, you'll be placed in the jury box. You may be asked to wait while all impaneled jurors and other case participants are tested. It is unlikely you have COVID-19, but please continue to follow all hygiene and safety measures in place. If you test positive, inform the court staff of your result who will confirm next steps. If you are at the court, please deposit your used test in the dedicated biohazard bin provided. Wash and/or sanitize your hands after depositing the test. It is recommended that you follow current health advice and guidelines regarding next steps supplied by the Ministry of Health and Unite Against COVID-19. Courts remain an essential service throughout all COVID-19 restrictions, but may operate differently. Please see the letter you were sent or our website for further information on the current process, www.justice.govt.nz. You can also call us on 0800 Courts if you need help, 0800 268 787. Thank you for your time. Ngā mihi.